Hi everyone, welcome to today's session on tobacco control in Alaska. This is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. We are happy that you've joined us today. We're pleased to be offering this webinar series. We'll be offering webinars on the third Tuesday of the month at 1 p.m. And this will cover a host of topics that are sure to be of interest. In addition to sharing our work with you, we hope that these webinars will spark interest in learning more about our projects, as well as opportunities for collaboration. To give you a sneak preview of upcoming webinars, we'll be featuring Alaska's Food Policy Council work next month in January, and in January, our Bike and Ride Safely program will be discussing our efforts on getting reflectors to children during the darkest months. Other ways you can stay connected with our work is through our monthly newsletter. You can sign up for this on the section's website. Our website address is at the bottom of all of our slides. A few housekeeping items before we start. Please mute your phones. Also, please do not put this call on hold. Rather, if you receive a call, please hang up and call back in. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes for question and answers. A couple more housekeeping items. Audio for the webinar will come through your computer. Another option is to call the number 562-247-8321. If you have technical difficulties, please let us know by using the question function on the GoToWebinar control panel. You will need a microphone on your computer, or you will need to call into the number provided to ask questions out loud. Please hold your questions until the end of the presentation. To ask a question, please raise your hand by clicking on the hand button in the GoToWebinar control panel. Before we get started on today's topic, I wanted to give you a brief description of our work in chronic disease prevention and health promotion. Our section's vision is for health and safe Alaskans, and our mission is to identify and advance the conditions that lead to safe and healthy lives. The primary aspect of our work include health promotion, chronic disease prevention, and data collection and surveillance. The icons you see here represent a few of our programs and projects. With that, I will hand the control over to our presenter, who can introduce herself and today's topic.
Thanks. Hi, everyone. My name is Allison Kulas, and I'm the State of Alaska Tobacco Prevention and Control Program Manager. And today's topic is Ending the Epidemic, Tobacco Prevention and Control Matters. So we do the work that we do because tobacco use remains Alaska's #1 killer of death in Alaska. Tobacco use causes more deaths than suicide, motor vehicle crashes, liver disease, cirrhosis, homicide, HIV/AIDS, and influenza combined. So we set up our tobacco prevention and control program under 4 main goals that guide our comprehensive program. We work to prevent the initiation of tobacco use, eliminate exposure to secondhand smoke, help tobacco users quit their addiction, and eliminate tobacco-related health disparities among populations. And we do this using the public health framework. We look at a comprehensive program that uses population-based strategies to reduce tobacco use and improve health in all Alaskans. It takes society as a whole to protect our kids and make the next generation tobacco-free. We enlist partners from all sectors and implement proven public health strategies. This includes 38 grantees working in approximately 200 communities across the state. We work on state and community interventions, cessation interventions, health communications, surveillance and evaluation monitoring, and administration of our program. The population-based strategies that we'll talk a bit about today include policies like smoke-free public places, price increases for tobacco products. We support all Alaskans ready to quit tobacco with Alaska's Tobacco Quit Line, and we work with healthcare systems throughout the state on comprehensive cessation changes. We also do a health communication mass media campaign focused on each of these different topics. And then we also do data collection and analysis to really track our progress of how we're reducing tobacco use over time. So in order to work on all of this, we have a statewide network of prevention. We rely on a staff of 9 State of Alaska employees. We have 38 grantees across the state, like I mentioned, who work with coalitions in their communities and throughout their public health region to really address these strategies. And then we rely on our network of partners. This includes folks from American Cancer Society, American Lung Association, as well as our Alaska Tobacco Control Alliance, leaders across the state in cities and tribal leaders, as well as our school district partners and healthcare organization leaders. So for more than a decade, Alaska's commitment to a sustained comprehensive tobacco prevention and control program has demonstrated significant progress in reducing tobacco use and minimizing the harms and healthcare costs associated with tobacco. In 1996, the blue line represents Alaska's smoking prevalence among adults, and in 1996, we were at 28%. By 2013, our SUSTAIN program has helped to reduce that number to 22% of Alaskan adults. This represents about 30,000 fewer adults smoking and saves us over $300 million in healthcare cost savings. Our program costs approximately $16 per capita per year, and that's 250,000 years of life saved. We've also reduced youth smoking rates. In 1995, our Alaska youth smoking rate was at 37%. By 2013, we had to reduce that number by over 70% down to 11%. However, progress has really stalled in our youth numbers, and in 2015, we'll talk about it a little bit later, but we're still maintained at that 11%. So what the work is that we do across the state, we really work on those policies in that public health framework that I mentioned earlier. And Alaska really leads the way in a number of policy changes. We have really tackled e-cigarette policy and our health communications. We were among the first states to review the research and put out messages that e-cigarettes are not harmless and they are not healthy. We also have communities across the state that have increased the price of tobacco. In 2014, Petersburg voters adopted a $2 per pack cigarette tax and a 45% of wholesale of other tobacco products, which does include e-cigarettes. They've also added a local registration fee for anybody selling tobacco needs to register with Petersburg. We had the same success in Kotzebue in the Northwest Arctic Borough, who just recently this summer increased the tobacco tax to $2.20 per pack and 55% wholesale of other tobacco products, also including e-cigarettes and a local license fee. Sitka increased the tax that they've had for a number of years. This is their third tax increase, now at $2.46 per pack and 90% wholesale of other tobacco products, which includes e-cigarettes. In Juneau, they have the highest tax in the nation. They've just recently increased their tax to $3 per pack and 45% of wholesale of other tobacco products, including e-cigarettes. The Matsu Borough in August also increased their tax to $2.30 and 55% wholesale of other tobacco products, which includes the e-cigarettes. Taxes have been shown to be the #1 policy strategy to prevent youth from initiating. Studies have really shown that a 10% increase in price will reduce that youth initiation number. And it also impacts our disparate populations. Those who are most price sensitive are the ones that are most positively affected by a tax increase. And so we've been really proud of all of our communities that have taken such strong stances on tobacco tax. and have increased their local tax in addition to the statewide tax of $2 per pack and 75% wholesale of other tobacco products. In addition, we've also worked on other policies to reduce disparities. We now have 113 tribal resolutions across the state. Tribes have taken a leadership role in successfully implementing smoke-free or tobacco resolutions to promote a healthy community within their tribal members. We also, in 2011, had the Alaska Federation of Natives sign on for a resolution in support of smoke-free workplaces, as well as the Alaska Native Brotherhood and Alaska Native Sisterhood. Our tribal partners have been key in making such strong stances against tobacco use in their communities. We also really partner with our school districts in this effort. We now have 33 Gold Star school districts, which means that they have a fully comprehensive tobacco-free campus policy that impacts all staff, students, and visitors on the school district campus in every location, 24 hours a day, 7 days a week. We also have 4 school districts that have signed on as Silver Star campuses that have really taken some bold steps to promote a tobacco-free campus, and 1 school district is at a Bronze Star level. So we've done tremendous work at really setting up these policies and changing the context in which our communities and our citizens grow up in, but our work is not done. Tobacco companies still spend $8.8 billion a year, which is more than $1 million every hour, to keep us tuned in to their deadly message. We are constantly fighting a tobacco industry that is still marketing to our kids and is still getting people addicted to their products. In addition, we have several other work to do. We work to promote health equity among all Alaskans, but we've had new items like e-cigarettes displayed at the top of the screen that are tough to distinguish between makeup and fragrance and sometimes go undetected within our schools. We also have slowed in our smoke-free progress. Communities across the state have adopted smoke-free workplaces within their communities. And we've gone about as far as we can with over approximately about half of the state is protected by a smoke-free workplace. Palmer was one of the more recent ones, but it's now been several years since Palmer had passed their smoke-free workplace. So there's much work left to do. So this slide shows the health disparities that we see in tobacco use across Alaskan adults. All adults smoke at a rate of about 22%, but you can see there are huge disparities when it comes to Alaska Native people and people of low SES. We also are really tracking disparities among age groups, and our young adult population of 18 to 29 is a concern for us, and so we've really implemented a lot of new strategies to address this population. And we're really proud of the fact that the University of Alaska system is going tobacco-free. All campuses will be tobacco-free by January 1st, 2016. The University of Alaska Southeast was the first one to adopt this policy and implement it July 1st. And on Thursday, November 19th, University of Alaska Anchorage will go tobacco-free. And then UAF will be the final one, December 31st. So we're very proud of our leadership for taking such a strong stance in protecting our young people. In addition to this, we're tracking nationally that we've known that people with mental illness smoke approximately 44% of all cigarettes produced in the U.S. And almost half of the deaths that occur each year from smoking are among people with mental illness and/or substance use disorders. Up to 75% of individuals with serious mental illness or addiction smoke cigarettes. So over the last year, we've really taken a look at what our Alaska-specific information is. And so we tracked smoking prevalence by mental health markers, looking at those of mental health not good on 14 or more days using the BRFIS, the Behavioral Risk Factor Surveillance System, tracking those smoking prevalence among those with major depression, any limitations that they had, how many days a mental health condition or emotional problem kept them from doing work or other usual activities, 7 or more days, 1 to 6 days, or no days, as well as those with serious mental illness. And so we just included these questions on the Alaska BRFIS. These are from the 2013 numbers. And we also now ask on our Alaska Tobacco Quit line if people are experiencing any of these conditions, as well as if they see that that will inhibit their ability to quit. Really partnering with behavioral health is something that we have been working towards over the last several years, partnering with folks in treatment centers. Our grantee at Aquila has been very successful at implementing a tobacco-free campus policy, as well as tracking smoking prevalence and treating addiction within the mental health setting. We also have been looking at smoking prevalence among Alaskans who experience adverse childhood experiences, or ACEs. And so this is reported of anybody who has experienced abuse, which includes verbal, physical, and sexual abuse experienced by a child when they were a child, household dysfunction, which is witnessed by the person and includes mental illness, incarceration, substance abuse, parental separation or divorce, and domestic violence. This information is 2013 adult survey info, and our partner over at the Alaska Mental Health Board has been tracking this over time to really correlate our smoking use with the ACEs score. Also in 2015, we added to our youth risk behavior survey questions about e-cigarettes. And so you may have heard us in the news at the end of October when the commissioner released information about ever use of e-cigarettes and those who currently use any tobacco products. You can see this is just a point in time measurement. 2015 was the first time that we had asked about this question, but we now have remained flat with our current smoking progress at 11%, but 18% of Alaska youth are currently using e-cigarettes. And we've got about 1 in 3 Alaskan kids currently use any tobacco products. So this is something that we've been really monitoring as a program and will be currently addressing. And you can see across grade levels, we're also tracking that use to really kind of see when kids are trying it, if they've ever used, and that progression into potential addiction from e-cigarettes or combustible tobacco. And what I had mentioned earlier about the tobacco-free school zones, anybody who has passed a Gold Star policy, they do include e-cigarettes within that campus policy. And so that's something that we are trying to communicate with our school district partners and provide signage for anybody who's interested. So the good news is that the majority of Alaskan smokers want to quit. They are aware of Alaska's Tobacco Quit line, which provides free help, counseling over the phone, web, or text, and free nicotine replacement therapy. Alaskan smokers are also being advised by healthcare providers to quit, and over half of our smokers are making that quit attempt. But we have some challenges there when it comes to making a plan to quit within the next 30 days. And for people staying quit, we've got about 6% is our quit rate for 3 or more months of the past year of current smokers. And this again is 2013 behavioral risk factor surveillance systems. And so this is really where it comes to, we have to work together as a community to support each other in youth prevention and supporting those tobacco users in their quit attempts. There are many ways that you can get involved. We have local coalitions across the state that you can get in contact with, or you can sign up for the Alaska Tobacco Control Alliance at alaskatca.org. There are much more information on that website of how to be involved in ATCA or any one of our work groups. You can also work to support policy change at the school, community, tribe, healthcare system, or workplace level. This work, we are not successful in reducing these tobacco use rates unless we all work together at every level to really reduce tobacco's impact on our communities. If you'd like to request resources or technical assistance, please feel free to email us at tobacco@alaska.gov, and we will be more than happy to send out any resources to you as well. And I'm more than happy to take some questions, and this is my contact information if you'd like to be in touch. Thank you.
So thank you very much, Allison. Let me just jump in here and remind everybody, if you want to ask a question through your computer, hit the raise your hand button. It looks like a big hand that you click on, and we can unmute you, and you can ask your question through your computer. You can call in through the phone line. The same thing will happen. And other than that, we'd really like to hear your questions or just thoughts on this, ways that you think that we could collaborate more. Let's see what you got. I don't think nothing for the moment. No questions. I had a question for you, mainly just because I'm a chronic disease person. And I was looking at your chart that you had towards the beginning that had tobacco use as the #1 cause of death. Can you talk about a little bit about what goes into that? I mean, what are they attributing as causes? What are some of the health issues that smoking relates to, and what are the major factors that go into that? Do you know?
Mm-hmm. Well, actually, I'll refer that question to Andrea Finati, who's our deputy section chief and our chronic disease epidemiologist, and she can help with that question.
Switching seats over here. Hi, everybody. So I can give a quick answer to that, which is we use a program provided by CDC called SAMIC that takes the numbers of deaths in Alaska for specific conditions that are known to be related to smoking, so heart disease and lung cancer and other conditions, looks at our Alaska-specific death data, looks at our specific smoking prevalence among men and women at different age groups, and does the formula that gives you the magic band that gives us a projected number that have died from smoking in Alaska.
Thank you.
Yeah.
All right, there was a question that somebody typed in. Is the PowerPoint available? Ann, can you talk about the process about that? We've got a couple people in the room here, so we're calling them up to the mic. Hold on.
This is Ann Potempa. I work with the section, and usually within the week after these are finished, we put the recordings and the PowerPoints on our webinar webpage. We will likely have this one up next Tuesday. So as soon as that goes out, what I do is I send an email to everybody who's registered, whether they're participating today or not, with a web link for both the PowerPoint and the video.
Thank you. All right, looks like we have another question somebody wrote in. Maybe what might be behind the 6% quit for 3 months?
Oh.
Does that seem very successful? So a question about like what's going on there with that only 6% quitting.
Yeah, well, we know that tobacco and nicotine is one of the strongest addictions out there, and so a lot of people make several quit attempts in a lifetime before they are successfully quit for good. So we generally track a 3-month quit rate because if at 3 months you're still quit, there's a likelihood that you will maintain that quit. And so it's just really hard when it comes to breaking that addiction because it is so strong. And so it's us changing the context as a community to really provide that support for people in their quit attempts, and to also prevent people from becoming addicted in the first place. So 6% seems really low, and it is, but we're doing everything that we can to really support those tobacco users in their quit attempts and break that addiction for good.
Any other questions out there? All right. Well, with that, I think I'd like to say thank you again, Allison, for doing this. Again, we'll be emailing this out, leading you towards our website so you can see where, hold on, we're getting one more question, hold on, where you can see, get the PowerPoint and Pat, look at this video recording. Now we're getting more questions. People are scrambling now that I was about to hang up. Does anything more need to be done?
Yeah, we're still working the strategies that I mentioned in the presentation. We have evidence base that leads us to strategies that will work and that have been proven to work, like smoke-free workplaces, tobacco tax increases, asking at every healthcare visit if people are ready to quit tobacco, and providing those resources. But it really takes all of us together to increase the number of policies that we have across the state. We've had a lot of success at the local level, and there is some work being done at the statewide level as well that the Alaska Tobacco Control Alliance is tracking very closely. Legislation that's still currently active. And so you can reach out to them to kind of get more information about what you can do at a local level or support those statewide movements. There's always more to be done. And I guess the other thing is that, we have this great evidence base, but one of the key goals is to identify and eliminate those tobacco-related disparities. And tobacco disparities are really high across our state, and so we work as a program on health equity strategies and coming up with community-based solutions to really tackle those disparity issues that will work for folks. And so partnering with the Alaska Federation of Natives, our tribes, our universities, really coming up with some new ideas. We're always open to those types of new ideas to address tobacco use.
So what's
is there an effort to engage medical providers and doctors more in screening and encouraging quitting at every medical visit? Yes. So we have been working for a number of years to really do a lot of provider education. And so we have toolkits available for healthcare systems looking to do either, a single tobacco policy or a comprehensive healthcare systems change. So we do have toolkits that you can email me for more information, and I can send a toolkit out to you. But we also have online training for providers. We have akbriefintervention.org is where you can find additional training and get a free CME credit for different healthcare provider types, such as doctor, nurse, CHAP, behavioral health provider, dentist, and pharmacist. So we've really broadened that training and really reaching out to the medical providers. But we're always interested, if you have new connections that we haven't maybe thought of before, please let us know how we can get the information out.
I think that's the last question that I'm seeing. So thank you again, everybody, for dialing in for this. If you're looking for an email with a link to the PowerPoint and the recording for this session, and please look at our website for upcoming sessions. Thank you.
Thank you.